Dr. Annie Heiderscheit. I'm the Director of Music Therapy at Augsburg University, where I oversee the undergraduate and master's programs in music therapy. I am also the editor of Music Therapy Today for the World Federation of Music Therapy, and I serve as the chair of the Publications Commission. I'm also the Vice President of Communications for the International Association of Music and Medicine. In addition to my work at Augsburg University, I have been a board-certified music therapist for 27 years. And much of my clinical work has focused in working with clients with eating disorders in a wide array of clinical settings, from inpatient to partial hospitalization to intensive outpatient programming, as well as residential treatment programs. And I'm looking forward to taking time today to share my experience with you in working with clients with eating disorders. I'd like to give you a little overview of what we'll be covering today in this tutorial. Today we'll be looking at the prevalence of eating disorders in our culture. We will be exploring the diagnostic criteria of the various eating disorders diagnoses and looking at the causes of eating disorders, as well as the physiological and psychological complexities associated and often innate within eating disorders. We'll be looking at addressing the needs of eating disorder patients in the various levels of treatment that they may encounter, as well as how we go about implementing and adapting music therapy interventions for the various needs that they might have in treatment at these different levels of treatment as well. The relevance of all of this is the importance of understanding the causes and the comorbid issues that arise with eating disorders helps to ensure that we are providing appropriate treatment for our clients, appropriate for the underlying issues as well as for the level of treatment that they might be in at any given time. Additionally, we have to understand the complexities of an eating disorder so that we can address the unique and specialized needs of these clients as well. Additionally, we need to recognize the many different ways that we can use music therapy as an effective means of treatment for our clients, and not only adapting to diagnoses, to comorbid issues, to levels of treatment, to underlying issues that may come up. So many different issues we need to address. So understanding how we use the music and our music therapy techniques to effectively do that is really critical to the treatment we provide and its effectiveness for our clients. Additionally, here's what we'll be taking away. Here's the learning outcomes from this online tutorial. So to develop an understanding of the causes of eating disorders, to understand where are these coming from, as well as to understand the diagnosis, because then we are familiar with the symptomatology as well as comorbid issues that clients are going to experience as a part of their diagnosis and as they navigate their way through treatment. We need to understand the physiological as well as the psychological complexities, because all of these will impact them through the course of treatment, and we will need to know how to address those in order to be an effective part of their treatment. Again, we're going to learn how to adapt our music therapy methods and all of the four methods that we have, from recreating music to receptive to composing and creating music with our clients, and how we adapt those to all of their unique and specialized needs, and how we then also understand how to address the issues that are underlying the eating disorder itself. So those are our learning outcomes for this tutorial. So we'll be covering lots of information and have lots of takeaways as a part of it.